Hello, my name is Helen Moretti. I'm a registered nurse, and I'd like to talk to you about fall prevention and response. First, I'm going to talk about the risk factors, and I'll discuss 2 case summaries, and finish up with techniques for handling a falling person. Now, the elderly are the highest at risk. They're followed closely by people with walking aids such as canes, walkers, or even people that use furniture to move themselves from place to place. Children, you can't do that much about. Medication that causes dizziness is a high risk. One of our most recent populations at risk are the veterans who are coming back from combat with traumatic brain injury. Shoes are a great cause of many falls. Flip-flops, clogs, any type of loose shoe. We had a lady come into our clinic wearing clogs. She tripped, fell into a wooden bench, broke one shoulder and 2 of her front teeth. We also had a young man, 21 years old. That's young. He came in complaining of dizziness. Unfortunately, none of the staff had him sit down. While he was walking to the magazine rack in the lobby, he fell, hit his head, and sustained a subdural hematoma that could have led to death and brain damage. Now, how are we going to handle these situations? I have 2 techniques for handling people that are falling. My first one is using the wall. When I worked in the operating room, there were many fathers who fainted while watching their wife's C-section. While I was walking about doing my duties, I would keep an eye on them, and if I looked like I was going to lose them, I simply pushed them against the wall and let them slide down. After a couple of minutes, they came up, everyone pretended nothing happened, and Dad slowly picked himself up off the floor. Now, what if you don't have a wall that's readily available? Please do not try to catch that person. You can injure your back or the person you're trying to help. So what do I want you to take away from this? It's just breaking the fall and slowing down their trip to the floor. And that can be done with a shoulder width stance, one foot slightly in front of the other, and using your body just like you would use the wall. You just pull them to you and slide them down to the floor. Now I'm going to use my son Carlos to help me demonstrate. First we'll do the wall. Okay. All right. Please pay special attention to their head. Once they're safely down on the floor, call for assistance or an ambulance, whatever the situation calls for. I hope this presentation has given you a tool to use in case you're around somebody that's fallen down. If you have any questions, I can be reached at hmoretti85@gmail.com.